afternoon, everyone. My name is Lucy Jameson from the Children's Institute at the University of Cape Town. I'll be moderating the event this afternoon. And on behalf of the Children's Institute, the South Research Unit, Sonke Gender Justice and UNICEF South Africa, I would like to welcome you all. This is the fourth event in the series on the intersections between violence against women and children. Previous sessions have covered the common drivers and impact of violence against women and children, the global frameworks, Inspire and Respect, and last week we heard about interventions to end both forms of violence. Today, the panel will address the question, do South African policy frameworks provide for an integrated approach to end violence against women and children? And do those policy frameworks also support promising interventions? But before we turn to our panel, I would first like to invite Reverend Bafana Khumalo to briefly share with us his reflections on the mood in South Africa at present and where we stand in relation to our commitment to end violence against both women and children. Reverend Khumalo is co-founder and co-executive director of Sonke Gender Justice, and his work in fighting for gender justice has been recognised both at home and internationally. He was a commissioner at the Commission for Gender Equality, but whilst he deals with the highest echelons of government, he's still very much grounded in the community and regularly conducts dialogues with men. Reverend Khumalo.
Thank you very much, Lucy. Good afternoon, colleagues. As we meet here today on this important conversation, we are aware that the levels of violence against women and children in South Africa remains very high, unacceptably high. Just this past week, we were confronted with a situation of a senior leader of the ruling party in one of our provinces who is currently facing a court case with allegations of having raped two of his daughters. And we, at the same time, learned just a few days ago of a counsellor who in Limpopo gave a lift to a young 14-year-old girl and on the way drove to a field, forcefully raped her and offered her a cell phone and some money. I'm laying these two examples as just part of the challenge that we are facing in a country where we have what one would call promising policy environment, and yet the reality on the ground remains very sordid for women and girls. If you have leaders like these, a councillor and a member of a legislature committing such acts, it really lays out the challenge that is confronting us in the sector that are dealing with these issues of gender-based violence. It points out to what I would call a very serious dysfunction in our society insofar as it relates to the challenges that women have to face every day, even in their own homes where they cannot be safe. We also, of course, have to contend with what I consider to be failures of the criminal justice system of various forms, either in terms of how police do not investigate reported cases adequately, ending with these being thrown out and not proceeding to the criminal justice system for finalization by our courts. Or you have cases that get dropped in court because either the prosecution has had some lapses in how they have taken up these cases. The case of Andiswa in Kwatema, Sithole, who was stabbed and left in a field by a boyfriend, comes to mind. A case that was investigated for well over 2 years. And on the day when it was enrolled to be in court, the family to be told at the morning when the case is supposed to start, that the case has been withdrawn because there's insufficient evidence. It's preposterous that the NPA would enroll a case to start in court, subpoena witnesses, and on the day of the court case, discover that actually they do not have sufficient evidence. We also are confronted, of course, by the context of dangerous, what I call dangerous norms that influence this negative behavior, embedded in what I call toxic masculinities, which are based on patriarchy. And unless we are willing to confront this challenge of what patriarchy means in our society, I argue we will never deal with the scourge of violence against women and children. Civil society has engaged and lobbied very strenuously, at least for many years, but in the last 5 years in a concerted effort, calling on government to set up a framework for a comprehensive response to gender-based violence in South Africa. And this has paid dividends because, as we all know now, we have the National Strategic Plan on Gender-Based Violence and Femicide, which the President signed in March this year, which lays out a very important framework in the battle to end violence against women and children in South Africa, giving us a coherent response as a country so that we indeed need to take this process forward meaningfully. It is important, I want to suggest as I conclude, that for a meaningful response, we must have political leadership. We need political leaders who are willing to come to the party and provide leadership on this important scourge that is bedeviling our country. And in that context as well, we need to have male allies that take this work seriously and contribute to all efforts that seek to end the scourge against violence against women and children in our country. We are seeing a glimpse of some of that effort through several interventions in our society, but we need more of these efforts to show and push for an end to the challenges that we are facing. I'm sure that in this seminar we'll hear more from my colleagues who will be outlining some of those interventions. I look forward to the good conversation going forward. Thank you.
Thank you very much. And just before we go to the panelists for today's webinar, let me just point your attention to the Q&A and the notice board. You will see that Naziswa has kindly put up there for us today's question, and we would be very grateful if you would like to engage and comment on that question during the debate. That's open for you. There are also the hashtags, so if you would like to engage in social media, you can use those hashtags, or also use the Facebook and Instagram pages. We are going to have each panelist will present for 15 minutes, and that should allow us for 20 minutes of questions and answers at the end of the session. So we look forward, as I say, to welcoming your questions and comments. So first on our panel, we have Kayan, who is the Policy and Development and Advocacy Manager at Sonke Gender Justice. She has a lot of experience in the areas of strategic litigation, policy advocacy, community engagements to ensure the rights in the Constitution are realised for all, but most importantly, that it's done through an intersectional lens. Thank you, Kayan.
Good afternoon, everyone, and thank you very much. I just want to start by sharing my screen. So I have been asked to speak about the key legal and policy frameworks relating to violence against women and children today. So there are a number of legislative and policy frameworks that underpin key interventions in responding to violence against women and children. And I will briefly go through them and then move on to some of the recent judgments that impact some of the developments within this policy and legal framework, and end off by just giving a brief analysis of where we are at, and hand over to my next panelist. So I think it's really crucial for us to start with the Domestic Violence Act, which seeks to essentially protect women from domestic violence, creating obligations on law enforcement bodies to protect victims as far as possible. And the Act essentially recognizes that domestic violence is a serious crime within our society and has extended the definitions of domestic violence to include married women and children, but also unmarried women who are involved in relationships or living with their partners. Now, the issue with the current version of the legislation is that although it seems progressive in its initial drafting nature, the implementation of the state assistance, whether it's been in the form of protection orders or finding alternative accommodation or even medical assistance, has historically proved to be very disappointing and lackluster. And as indicated by Reverend Khumalo, there is systematic failures in terms of implementation of existing legislation, such as lack of training and knowledge on the part of service providers, such as the South African Police Service, in terms of fulfilling their duties to survivors. And they are also acknowledging resource constraints that have been cited for a number of reasons, which lead to the ineffectiveness of this legislation. So essentially, there's a mismatch between the policy intention of this act and the strength of the intervention that it's achieving in reality. And this has resulted in persistently high levels of violence against women and children in the country. Now, what's interesting to note is the current draft version amendment of the DVA looks predominantly at progressive, measures, and has taken a more victim-centric approach to ensure that the prevention of secondary victimization is alleviated. And the hope is to ensure better interventions on accessing services to, survivors of violence. Moving on to the criminal law amendment, the sexual offences and related amendment. This is broadly characterized by having extended sexual offences to the pre-1997 narrow common law definition of rape. And further, it includes a number of instances of compelled sexual acts, and sort of has defined sexual acts to include, both penetrative and non-penetrative sexual acts. What we do see, though, is that in terms of this current act, we actually see that the statutory protection is, in essence, not always effective because of the inability of survivors or victims to actually attain redress in these services. One of the current amendments to the sexual offences and related amendments currently going through Parliament is they are proposing to extend the National Registry for Sexual Offenders to include all vulnerable groups, and they've listed a definition of that, and it would extend beyond children and those with mental illness. And very interestingly enough, they want to make the registry public to all. And there are a number of concerns and debates around this from opposing parties, because I think in essence it seems like a very reassuring move from government, but I think there are long-term knock-on effects and constitutionality challenges that might be arising if this is passed. It also extends or further regulates the reporting duty of persons who are aware of sexual offences that have been committed against children, and introduces a new offence of sexual intimidation. The South African Schools Act, Employment of Educators Act, the South African Council for Educators Act, Child Amendment Act, and the National School Safety Framework all speak to a responsibility on the state to protect learners from maltreatment, neglect, abuse, or degradation, and take measures to prevent violence against children. I think what is quite interesting is the National School Safety Framework was designed to provide a comprehensive document that can guide the Department of Basic Education schools in district and provinces on a more common approach to achieve a safe, healthy and violence-free learning environment. And it was also intended for other national and provincial departments to be involved in a way for them to realize a safe school learning environment and the common understanding of the nature and extent of violence in schools. If you look at the National Crime Prevention Strategy, that was essentially established to address violence against women and children as their priority. And legislation such as the Recognition of Customary Marriages Act, the Criminal Law Amendment Act, and the Prevention of Combating of Trafficking Persons Act also deals with traditional harmful practices such as the banning of child marriage and the practice of ukutwala. So moving on to a few other legislations, you also have PAPURA, which is essentially looked at preventing and prohibiting unfair discrimination and harassment, and it is aimed at promoting equality and preventing, hate speech, and that should be complementing the draft hate crimes bill that is currently in the process of hopefully being finalized. And you also have the Children's Act and amendments which were acted in engaging and protecting children from maltreatment, neglect, abuse or degradation. The Child Justice Act was established to deal with children who are in conflict with law and prevent and realize Section 28 of the Constitution and its international obligations on the Convention on the Rights of Children and the African Charter on the Rights of Women and Children. In terms of the childcare and protection policy, which is quite an interesting policy, this policy recognizes that many at-risk children are trapped in, I think this was alluded to earlier, an intergenerational cycle of risk, and the government not currently providing the development services necessary to break the risks afforded to this and breaking and addressing that cycle of violence. So this policy was sought or developed to ensure a national public program and systems to ensure that all children survive, develop to their full potential. And it is not only about protecting them from harm, but going above and beyond that to ensure that they actually realize their full potential and are protected and able to participate in society. And what it essentially required was that there were a multiple number of role players that needed to work together to achieve this common vision. The white paper on safety and security also looks, or was proposed to look at, addressing violence, not only from the duty of the police responses, but it looked at 3 pillars on how they should be integrating, prevention mechanisms and how that contributes to a safe and secure environment. And finally, my second last point that I wanted to raise is on this slide is that we also have a national school safety framework that also focuses specifically on comprehensive documents to provide a safe and healthy violence-free learning environment. And one of the most integrated attempts, I would believe, was the Integrated Plan on Action in relation to violence against women and children. Now, this plan was initially started in 2013 and it ran until 2018. But what is important to know about this was supposed to be the attempt to bring an integrated approach to responding to violence against women and children. However, if one refers to the 2016 report, it was a diagnostic review on the state responses to violence against women and children. It actually, in summary, found that the legislation, in terms of the legislation, there was a huge implementation gap between the legislation and whether or not it was effective in terms of what it was planning to do. And there was a lot of lack of clarity around what the specific mandates were for the departments to carry out their functions and require for them to realize the objectives of this plan. In terms of the mandates and policies, they also found that there was a lack of alignment in the overall planning framework for this plan of action. And therefore, the intended outcomes for the violence against women and children was, although set out in the plan of action, it didn't align with the outcomes in the department strategies, annual performance plans. So essentially, it seemed like it had a plan in action, but in terms of implementation, it wasn't, number one, implemented accurately, or it failed to because of the lack of mandates for the specific departments that they were supposed to bring in. And it also made a recommendation that they needed to actually revitalize, strengthen, and relaunch the plan of action. And they specifically looked at establishing a common conceptual framework for understanding and addressing violence against women and children, incorporating new evidence generated in studies. They wanted more consultation with relevant stakeholders, and they needed to align the departmental performance frameworks and ensure that funds were appropriated for the specific plans. So that led to the revision of the plan of action in 2018. So I'm just going to put a hold on that and then move on to two judgments that are quite relevant to the discussion. So when we speak, I alluded to the Domestic Violence Act and how it really speaks to the protection of women in the family home. And in essence, in theory, it was supposed to offer similar protection to children as well. However, the issue of corporal punishment in the home was a long-standing question mark within the South African context. And in 2019, the Constitutional Court confirmed a decision from the Gauteng High Court, which essentially confirmed that the common law defense of reasonable and moderate parental chastisement was inconsistent with the provisions of the Constitution, and therefore invalidated the defense of moderate and reasonable chastisement means. And so it no longer afforded one's defense based on the practice of religion or culture to raise the defense and actually provide corporal punishment to their children. They also highlighted the importance of the best interest of the child as paramount. Now, this case essentially means that it is going to have to relook at the legislation related to the legality of corporal punishment, specifically in the home. And this implementation or the effect of this Constitutional Court judgment essentially removes the defense and the arguments for violence in the home against children, which is a key component of the intersection between violence against women and children, because I'm sure in your previous webinars you've discussed a lot of the sort of intergenerational cycle of violence and contributing factors such as, the shared risk factors, the common social norms, and also the co-occurrence of linkages between intimate partner violence and violence against children. A second very interesting judgment at the Constitutional Court was the Levantine versus Frankl Judgment. Now, this judgment was crucial because it essentially dealt with whether or not the amendment of the Criminal Procedure Act and a specific section that said that there was a prescription period of 20 years for sexual offences, which specifically listed certain forms of sexual violence, including rape. They noted that the 20-year prescription period was inconsistent with the Constitution and invalid to the extent that it barred the right to institute prosecution for all sexual offences after the lapse of a period of 20 years from the time that the offence was committed. And in this case, you often found that a lot of the survivors of these sexual offences against Levantine were children at the time. And they also interestingly acknowledged the level of trauma experienced by victims of sexual abuse, and that it was not determined by whether or not that victim was or survivor was penetrated, but it depended on a multitude of other factors. And so whether or not something was construed as a serious crime, it was important to take consideration the trauma that was imposed on survivors or victims in that sense. So moving back to the issue of the plan of action for violence against women and children. As I mentioned before, that draft was revised in 2018, and there were processes where there were more consultations with stakeholders around that and redeveloping. But then parallel to this process, we had in August 2018 a national march under the Total Shutdown movement, where many individuals marched to Parliament saying that they've simply had enough of gender-based violence, and that a new plan of action needed to be actioned, and that government needed to take this seriously. And one of the asks was that we develop a national strategic plan on gender-based violence and femicide. So essentially, our latest attempt for an integrated approach, which includes, the approach of addressing violence against women and children, is the GBVF NSP. And having looked through the GBV NSP, you see mention of, look, I have to say that there's a lot of reference to, acknowledging that the disproportionate violence of GBV is against women and other vulnerable groups. And they also mention children too. And you'll see in the slides, they've actually given a number of quotes. So they want to optimally harness violence against children programs and have an impact on GBV eradication. They want to ensure that public spaces are made safe and violence free for all. They want to engage in interventions to protect children from violence. And, they also want to look at the views and perceptions from young people on GBVF used to track attitudes. But if one compares the draft version of the plan of action on violence against women and children and the NSP, you will notice that a lot of the initial planning and not just language, but engagements in itself and looking at with youth, adolescents and children, that has been lost in the NSP. And this is not a criticism against the drafted one of the NSP. I think they've done a phenomenal job on it, in a very short time frame. And also acknowledging the tricky, area of ensuring that something is fully integrated, taking a fully integrated approach and ensuring all the stakeholders. But I would argue that, in this case, there could have been sort of more inclusion or planning around consultations for example, adolescents and youth when developing their interventions across all of the 6 pillars. And some of the key interventions, as I've mentioned, relating to children previously, have fallen away. So it is regrettable that, in addition to that, it is regrettable, and I think this is an ongoing critique, to say that, number one, we've found that in the past, the government has not had political will to address the issue of violence against women and children. And secondly, there has not been adequate resources that are backing, the plans and policies that we have in place. So it is really disappointing to see that the GBV NSP is still not costed, and there are no funds ring-fenced to effect the implementation. Essentially, we need to look at this, and I think the criticism is that if we are to fully recognize and realize, the elimination or eradication of violence against women and children, we do, number one, need to have an integrated approach. We do need to have, look at the interconnectedness between violence against women and children, and look at those 4 key factors or 5 factors that have been previously discussed in the webinars, and how that is incorporated into the NSP plan. Because if this is the roadmap that we're working on, that's supposed to include all the stakeholders and parties, it is really crucial at this point that we get the planning right, so that we're not leaving anyone behind. And if we're leaving certain groups, like, if we're looking at a key demographic such as adolescents, for example, and engaging with them to ensure that their programmings and interventions are really consolidated, we are essentially losing an opportunity on addressing violence, the interconnectedness between violence against women and children. But I'm sure that the issue of the NSP will be dealt with in further detail by my colleague. So I'm just going to conclude in that regard. Thank you.
Thank you very much, Kayan. That was a very comprehensive overview of the existing law and policy, and an insight into some of the things that you think may prove challenging on the way forward. So we're going to move straight on to our next panelist, who is Dr. Nwabisa Shai from she's a specialist researcher at the Gender and Health Research Unit at the South African Medical Research Council. She's also an honorary lecturer at the School of Public Health at the University of Witwatersrand. She's got a huge wealth of experience in gender and gender-based violence, intervention development, adaptation, implementation, not just in Africa, but also in Asia and the Pacific. She's done everything from large-scale studies to detailed ethnographic work of South African femininities to understand the constructions of womanhood, and in particular looking at the impact of that for GBV and HIV. In terms of what she does with this wealth of knowledge that she's creating, she has played roles advising government, but also community-based organisations on evidence-based prevention, response programming and services. And she's also a member of the driver group for the Violence Prevention Forum, and she too served on the interim steering committee on GBV and femicide, and therefore was one of the key personnel who was involved in the drafting of the NSP on gender-based violence. So over to you, Nwabisa, for your reflections. Thank you.
Thank you very much, Lucy, and good afternoon, colleagues. So since Kayan has gone through a lot around the background to the NSP and has also highlighted some of the challenges around the NSP, I am not going to go over the history or any detail related to the POA and the relationship with the NSP, but I'm just going to start with an update to say that the National Strategic Plan on Gender-Based Violence and Femicide was launched in April 2020, and the interim steering committee was disbanded. But because of the challenges that kept coming up around violence against children, violence against women, and GBV more generally, the group was brought back, and newer partners actually came in to join that group. And they are currently now working on delivery on all the NSP pillars for the first 100 days. And my comments are going to mainly start with a focus around that, but then I'm also going to try and make an argument for what Kayan also mentioned, that there is a need to partner and collaborate between the violence against children, violence against women, and GBV sectors. And I think also one thing that I want to just raise is that from what I have seen, the role of the children's sector in the NSP work that's currently taking place is nearly invisible, and only a few actors are actually involved in the NSP. And I want to also raise a few challenges around the NSP and the work that's currently being done to highlight the need for collaboration between the sectors. Violence against children, as Kayan mentioned, is acknowledged on the NSP, but it has been difficult to ensure that the voices of children are maintained during this 100 days period. Perhaps because goal setting and implementation has been very rapid and focusing on shorter term goals, and the children's sector is perhaps finding it difficult to insert child-focused programming more effectively in such a rapid process. And I know that colleagues that are working in this field and that are representing the children's sector are doing their best. Another challenge is that the NSP and what is currently taking place around it to deliver to its goals are actually not well understood by all actors at the local, district, and even provincial levels. So perhaps we do not know where to begin. We are also contending with the COVID-19 pandemic, which has exacerbated existing social and economic inequalities, and it has created an environment where violence is really impacted in a devastating way. And the pandemic is also complicating all of our work. And we are anticipating that any government funding for programs or services will be viciously cut. And work on prevention and response is going to be severely challenged. So the main challenge is, how do we do more with less and do what really matters? And in terms of trying to think around that question and to look at potential ways that we could try and move the agenda forward, I think that the violence against children and violence against women in GBV sectors should be working together and building relationships, because they cannot achieve meaningful change on their own, especially under the current circumstances. Establishing relationships between these sectors can enhance and strengthen the existing systems and ensure that they're working seamlessly. Bafana has already raised the concerns around the CJS system already, and we need to also make sure, I mean, this relationship can also help to make sure that we start implementing the prevention programs that we have been avoiding because we are concerned about costs or the longer term perspectives of such interventions. And I have a few suggestions on how the sectors can work together within the parameters of the NSP. For example, the children's sector needs to increase its representation in the interim steering committee and ensure that it is visible in the work that's currently taking place, support the colleagues that are already representing the sector. And we also need to feed in suggestions for what are the priorities or practical steps that need to be taken, especially during this initial period, as well as in the long term, as well as in the medium term. And the sector also needs to engage with the previous, and it has already engaged with the previous program of action, knows what areas of improvement are actually needed, especially in the unpublished draft of 2018 that Kayan mentioned. But what I think is the task now is to actually draw the linkages between the NSP pillars and connect them with the POA pillars, and this can help to provide some guidance and some very useful ideas for what was envisaged needed to have been done before. And I think that those ideas would actually be appreciated. The actors must also co-define what programs and services and other work matter most, and how we can do more with less in a budget-constrained environment, and advise against spending on big campaigns, as we know that there is no proven evidence of effects there, and also advise against shifting of funds away from the desperately needed interventions and programs. And we must also creatively change the way that we do work without changing the core work that we actually do. And other opportunities, when I was looking at the NSP and the intersections between these sectors, particularly around trauma, violence, and gender inequalities, I identified a few opportunities which I think that the sectors should consider when they're looking at how they can collaborate. There is a glaring gap in the appreciation of the wealth of research from the violence against children space, and especially in the country. And we need to update our studies and create surveillance systems that begin from childhood. The collaboration could also identify research gaps, for example, in the linkages between violence against children, violence against women, and GBV. The COVID-19 pandemic and its impact has also exposed us that we do not have usable data that can be drawn from for both sectors. And the sectors must now work together to devise means that will enable them to use the rich administrative data that they have from their organizations, as well as helplines to identify program and service needs. We also need to harness some lessons on the pathways from the community work and research that is being done, how that is channeled to programming and services, and how to strengthen these. For example, comprehensive policy and interventions for children and adolescents can help to prevent them from ending up in abusive relationships, because it's very difficult to remove them from such violent relationships and behavior once they've started. And if we do not act now, then we lose the element of contribution towards primary prevention, or early prevention as some people prefer to call it. Now, we must also inform a bucket of services as these two sectors that link violence against children, violence against women, and GBV, and ensure that these can be localized, that they address multiple risk factors, and they follow a life cycle approach that ensures children, adolescents, young adults, and the older age groups receive programs and services that they need for prevention, response, and healing. And this can be achieved if we do not single out one type of abuse violence while neglecting the other. And if we also take into account the structural inequalities that families are facing. Another point is that the NSP does appreciate evidence, but we need to see that translated into the current work that's being done. And I believe that this collaboration could help to support government to think in and work in long-term, with long-term goals in mind. And yet we need to also be careful of the demands that we place on them. And having said all of that, I want to come to another sore point between the sectors, and to say that for us to be able to address for us to be able to work well together, we need to address what makes it hard for us to work together. Of course, we are not going to solve violence if you don't work on the relationship between the sectors, and we need to acknowledge the structural and political differences between the two. So to move forward with relationship building, we need to acknowledge and address the deficit of trust between the sectors that likely emanate from gatekeeping, racism, or even discrimination. And we must address the politics of who is allowed to have a dissenting voice, who's allowed to exercise an authoritative voice or not, or who can insist on a certain type of quality or ethics. We must be brave enough to actively listen to and address the deep democracy questions that arise from both sides without disintegrating into divisions. Yes, these organizations are different. We value ethics and evidence in different ways. And yes, there are issues of hierarchies which may actually make it very difficult for us to work together, collaborate or partner. But the women's sector has decades of theoretical and practical work based on feminism. They've helped to provide a clear understanding of constructions of gender and discrimination, and have effected and perfected models of support to abused women, particularly at the local level. The children's sector, on the other hand, is quite strict about how children's programs and services should be delivered. If they focus on they focus a lot on ethics and safeguarding of children from further trauma because of the high levels of vulnerability of children, and this is acknowledged in the X that Kayan already mentioned. And yes, the sector is dominated by many psychologists and social workers, with some with PhDs, and this may or may not highlight hierarchies between the sectors. It may or may not highlight issues of race as well. But both sectors have demonstrated a lot of passion and innovation and unwavering commitment that gives me hope that we are ready for a firm collaboration between them. And as I try to end my talk, I'm mentioning all of these things because I have recently noticed tensions in acknowledging the important role of parenting programs in prevention of gender-based violence. And I believe that these programs are seen to be elitist, racist, and undermining the ability of men and women to raise their children. However, I argue that this is not the case. I have developed many interventions in my career, such as stepping stones and creating futures, and I know that we do research in local communities. We obtain the views and experiences of people who not only fit the profiles of the beneficiaries of these programs in the communities, but they actually have similar experiences and ideas. And we combine what we learn from them with what we have learned actually works in prevention or even in services. And we combine these sets of information to design and create content or approaches that we use. And we test these, and we found that they actually some of them do work well within programmatic timeframes. And when they don't work well, we find ways and devise ways to actually strengthen them and improve them so that they actually work better and do not cause harm to our communities, to our children, to our women. And I think that process rigor and ethics actually matter, regardless of which organization you come from. And South African women and children deserve programs and services that do work. Having said all this, we should also be careful how we present ourselves as actors and contributors in this work, how we communicate our ideas or express our dissenting voices. And we must also understand that certain words, some, for example, may really be, original English words, but they may have meanings that are offensive and sometimes may even be reminders and triggers for the apartheid past that some of the people that we work with have gone through. And I know that, you know, it is possible for a working collaboration between the sectors to happen, but it needs to be facilitated in a reconciliatory manner and based on principles of respect, active listening, deep democracy, empathy, and a commitment to ensuring that we have effective partnerships and collaborations. And it's important for the sectors to approach that we all come from, you know, we're all trying to achieve the same goal of ending violence and healing our nation. And our policymakers also value our work, and they provide a wealth of knowledge on how government systems and budgets work, and working with them as well would be helpful to us enormously. And for this to happen, we must create opportunities to share, find common ground, address our deep democracy questions, and carve ways of working together. And we must do so intentionally and perseveringly. Thank you so much.
Thank you for that extremely rich contribution. I'm very struck in what all of the three speakers so far have said in terms of this huge gap between the fragmentation on the one hand of some of the laws and policies and the lack of the resources that we have, but also about this huge potential that I think came out very clearly in what Nwabisa has just shared, that we have a lot of innovative ideas, that we have a lot of information, and that if we actually can find it within us to work together, that we can do something that's really quite radical in terms of addressing the lack of services, but also the cultural norms, and to be able to work towards that single goal that we all have of ending violence. So thank you very much. That was very powerful and gave everyone, I think, a lot to think about. Our third panelist is Mayke Hayforex, who is currently the Chief of Social Policy and Child Protection at UNICEF South Africa. She is passionate about working with partners to reduce poverty, inequalities, and violence against children. And she has worked with UNICEF for over 20 years in the areas of social policy and social protection, child rights, and not just in Europe, South Africa, but in many countries across Southern Africa. So I'd like to hand over to Mayke now. Thank you.
Thank you very much, Lucy. I am sharing my screen. Reverend Khumalo, Dr. Kayan, Dr. Nwabisa, it's a great honor to come after you, and it will be a challenge to complement what you have just said. Lucy, can you see my screen? I can't hear you.
We can see your screen. That's it. It's now on full view.
Okay, great. So I have the pleasure to talk to you this afternoon on to complement the previous speakers, Dr. Kayan and Dr. Nwabisa, in terms of what are the global commitments that are being made, and what is still the magnitude of this problem in South Africa on violence against children and women, and potential solutions. So here you can see the outcry we have seen over the years and recently on really a call out to stop violence against women and children, and understand what we need to do to address the drivers to these high levels of violence against women and children. So first I'm going to present you the theory, what we should be doing, preferably, and then what are the potential resources that are required for doing so. So as we have all heard already in the previous series and today, is that the causes and the drivers to violence against women and children are overwhelming. And the task to address these are very complex and require deliberate and coordinated action from all stakeholders and duty bearers. And that's also what the previous speaker said. But what is possible, and Dr. Nwabisa just said it, we can create safe and nurturing environments by enabling parents and other caregivers and families as a whole as primary duty bearers to enhance children's safety, well-being and their development. So it will be important for us to really look at these primary caregivers and enable them as the task is positive and possible. And it is aligned to the country's rights-based development goals. The scope is therefore then limited primarily to empowering these primary duty bearers and caregivers. It's measurable, it's achievable, and the returns are guaranteed. So what are some of these drivers of violence that disenable this caregiving, which has been exacerbated over the last 6 months during COVID and consequent lockdown? One of is poverty, unemployment, rising unemployment, poor food security and nutrition. We see stunting levels going up, we see obesity levels going up, but also unresponsive caregiving, limited ECD coverage, low education outcomes, and a culture of violence that has existed in South Africa for a long time. So the response would need to address all these disenablers through a holistic package of family and caregiver support to enable a nurturing and responsive care that is universal, targeted, evidence-based, and provides quality services across the life cycle of the child. So prevention of violence through an enabling care and nurturing framework. How does this look like? So you can look at an entire socio-ecological model at all levels, starting from the child and ensure that every child survives, is protected, develops and participates. And that families are empowered to provide care, provide health, nutrition, information to the child to make sure the child can fully participate in decisions pertaining to his or her life and that their voices are being heard. That there are support services in the communities like your social protection, your ECD centers, your schools, your health centers, and access to safe water and sanitation, but also complementary support for care of that child by civil society and faith-based organizations, complemented and embedded in an overall framework of national policies and programs with global and regional child rights instruments. So how do we do it? To create an enabling care framework is to really address the risks that persist in families that drive violence. Through integrated government-wide action, I think we heard already this afternoon that there is a good high-level commitment, but how are we going to make sure that within departments and amongst departments there's going to be wide-scale collaboration, as well as together with civil society, to be aligned to achieve a shared goal with a systematized, integrated commitment to provide that nurturing and care framework to ensure universal coverage and identification and targeting of families at most at risk with a quality package of services, and then to continuously monitor coverage and the impact, and based on research to continuously improve these programs. So we are going to look at 6 core building blocks in order to empower governments to prevent violence by enabling universal nurturing care, to develop a child care protection system based on these 6 building blocks that's oriented and creates an enabling, nurturing, responsive caregiving in all environments. First of all, through identification of all families and risk assessment. Who are they, where are they, and why? For example, to start with children on the ground is a good entry point, because by nature these children, as they are recipients to the grants, are the most vulnerable. And from there you can then track their well-being and see how they are faring. So it is important to understand the risks that families and children face and adequately respond to them through a sustained provision of quality package of services that are provided in appropriate combinations throughout the life cycle, because a package for an adolescent is not the same as for a toddler, to effectively address the risk. through the policies and laws, adequate programs that cover all domains, with adequate human resources, infrastructure, financial resources. We heard it already, the budgeting and the costing that is important to be done. And then with a monitoring framework to allow for improvement and reporting. With the adequate leadership and coordination. What is the case that still needs to be met in the scale and the nature of the risks? So in South Africa, I've always been so incredibly impressed by the progressive realization of socioeconomic rights of children through a package of services, from prenatal care to adulthood throughout the life cycle, which you can see here on the slide. However, still fundamental vulnerabilities persist and that have intensified during lockdown, as 2/3 of children still live below the poverty line. There's still inequalities that are very high across race, gender, disability and geographical location. We've seen through the Optimus study that 1 out of 3 children are affected by violence or abuse before the age of 18, and not once but multiple times, which is becoming more and more compounded by mental health risks. Anxiety, fear, substance abuse, gangsterism, gun violence, and high youth unemployment at 63%. So who are these? What is this group that is most in need of this nurturing care? For example, from the 13 million children that are on the grounds, we know that children living in childhood households or as orphans or with disabilities or migrant children, 3.3 million of these children, they have difficulties to access services because of the care environment in which they live. Now that care piece, I always call it care piece, but it's actually the niche where we have to invest in prevention and early intervention services for these most vulnerable children to create a nurturing care environment is often taken care of by the state, complemented by civil society, who do the home-based care programs, who help with the parenting programs, and with that family strengthening program. And you can see on this slide that this support by the state to civil society organizations is limited in funding, as the majority of funds here you can see goes to the cash transfers, and to civil society organizations is at 0.1%. So what happened in 2015? You know, we came with a whole new Sustainable Development Goals. The Global Partnership to End Violence was established in 2015, and South Africa became a Pathfinder country in 2017 and went to the Global Summit in Stockholm in 2018. And at the global levels, partners committed to these 5 core principles to improve cooperation, just as we are saying, and coordination between different actors. To increase knowledge, which we also said, on how to prevent, detect and treat violence against children. Then to develop and share solutions and best practices to defend the safety, integrity and dignity of every child, including in the cyberspace, which became more and more an issue during lockdown when more children moved to virtual work. The need to invest more resources to prevent and respond to violence and to place all children first. The fact that children are not addressed at equal levels as women in the NSP, we have to discuss this as children do need concerted action as much as women, especially in violence prevention programs. So at the global level, various partners came to this Inspire package based on 7 core principles, based on the implementation and enforcement of laws, to address norms and values, to create safe environments, parent and caregiver support, income and economic strengthening, response and support services, education and life skills. So when we look at the Inspire package and the global commitments and the resources that are necessary, the implication of these global commitments are that we have a call to action Also, with the NSP, we have a call to action to scale up innovative solutions through systematization. So there is high-level leadership in the country. And for us to systematize the creation of a nurturing and care responsive framework, it will require greater coordination in scaling up and systematizing this nurture care framework within DSD and with other line departments, with the presidency and the Department of Women, but also with education and health and your statutory child protection actors like the justice sector, to ensure universal coverage of quality support to nurturing care. So how does an integrated child care and protection and empowerment model look like? So here you have the child at the center in a family environment, whereby the family empowers and ensures that the child has access to services and information. And when the child is in need of extra support programs, that the child has access to these special programs, complemented by a safe space after school, where children can come, hang around, have a meal, wash their hands, become empowered, develop their skills and information base to carve out their own path to the future, with intended outcomes to improve school performance and attendance, improve healthcare and status, improve nutrition, improve economic situation, and reduce violence and abuse, so that the child has access to the services and embedded in a nurturing environment. And the moment that there is need for the family support, there's complementary support through an integrated case management system through child and youth care workers and other social auxiliary workers. So then what are the gaps to reach these solutions? It will be important to really look at an institutionalized and systematization of a nurturing care framework. We heard about the child care protection policy to provide the mandate for care and protection. So the cash transfer programs are scalable and already at scale, but support for caregivers to provide nurturing and responsive caregiving is not yet at adequate scale. Integrated and information management systems are not yet adequate for planning, assessing progress and quality improvements. So the resource base for human resource to coordinate, plan, provide and monitor is not yet adequate. As we saw in the diagnostic review, also there is still need for the infrastructure improvement to make sure that all social service professionals and other actors have sufficient mobility, transport, communication needs to provide this conducive environment to operate in, and to coordinate within the department, but also across other line ministries in civil society. And then what will be important is to really make sure to strengthen the policy with a consequent resource envelope, to mandate DSD to provide the services for a nurturing, responsive caregiving environment in vulnerable families, to strengthen the national program with also a focus on violence against children and integrated information management system, and the mapping of human resource needs and infrastructure needs. Like we would do in the education and health sector, we would need to do that for the child protection sector, so that there are enough resources to follow up on cases, to get adequate witness and evidence, so that cases get to justice and justice is being done, and that these programs and the cost of the sector to operate efficiently are costed and adequately catered for. However, the state and the caregivers can't do it alone. We hear more and more about PPPs, public-private sector partnerships, as well as the social compact that we are learning from COVID through the Solidarity Fund and other actors. There is a need for a social compact to intensify investments in childcare and youth empowerment, through investing in family strengthening programs and safe parks after school, including the role of private sector philanthropies. So if we don't invest in that care piece and this nurturing environment with these high levels of violence against women and children, we saw in the Save the Children study in 2015 that the cost of inaction that year alone led to 5.93% of GDP, as so many women and children dropped out of work, dropped out of school, were in need of legal medical aid and access to justice. that bears an economy down in your production. And could you imagine if we could use all these resources to invest in violence prevention programs instead? So the return on investment in creating this nurturing care framework around families within communities has already resulted, based on the best practices that South Africa has, in improved attention in education, improved attendance at school, lower teenage pregnancy, increased adherence to medication for children on chronic medication, decreased use of substance abuse, increased take-up and retention on the grants, reduced rates of corporal punishment in the home because caregivers feel better empowered to dialogue and interact with their children in a quality manner, and quick identification of abuse. Lucy, I thank you so much for the opportunity. And before I stop, happy birthday for tomorrow. Thank you.
Thank you very much, Mayke, and thank you to everyone else for staying with us. I can see that there are already a lot of comments and questions in the chat. We appreciate that. And also, please remember to use the hashtags that are in there. Because we have got such a huge flood of questions, I will try my best to summarize some of them and group them together. We will pass questions that are not answered in the session over to the presenters, and we will post answers to them on the Children's Institute website and their forthcoming blog. But I'm going to dive right in there with our first question for Kayan. So there have been quite a few comments that speak to mental health and the link between mental health and the various forms of violence. And a key question is to what extent strengthening resources for mental health services for parents, caregivers and children and adolescents are going to, help us to reduce violence against women. We've seen some of that in the maternal and child health services, but the question is wondering to what extent we're seeing that in other components of the legislation. So focus, where's the mental health focus in all of this legislation? And then I think, if you could answer that, and then I will give direct questions to the other members of the panel.
Sure, thanks Lucy, and thank you Elmarie for the question. I think it really is important for us to acknowledge that one key component of mental health services for caregivers or parents and children should be looked at as a key factor in violence prevention. And certainly when you look at the NSP, and I'm not going to address the plan of action because that essentially is supposedly integrated into the NSP, and that's the document we're supposed to be moving forward with. Pillar 4 of the NSP, which refers to response care, support and healing, has an aim to be victim-centered and survivor-focused in accessing equitable and quality services, which should include mental health services and should be readily available, across all systems like the health system, the criminal justice system, education, and any social support systems at the respective levels. So what they're essentially trying to do is strengthen existing response care and support services by the state and civil society. I do think we need to acknowledge that resources is a big question, and I think it's come up on a number of occasions, and we do need to ensure that we don't just have policies in place that speak to, for example, the draft victim support services bill that is currently open for submissions. And we have this great idea that we're going to have all these services available, and when people phone, we're going to have a 24/7 call center that can provide a list of services. But if we don't have, number one, access to these services, and they're not quality services, we're really shooting ourselves in the foot. But it is, I acknowledge your comment. I think it is crucial that we look at this component of mental health services, and it should be available across the board, because it is key to addressing the issue of violence against women and children. Thanks.
Thank you very much for that response. Now, Nwabisa, there have been a number of questions relating to some of the definitions of the terms or how the scope of the terminology. And the first question is, does GBV include violence against children? And then there's a follow-up that's also, or there's another question that's asking, where do youth fall in that violence against women and violence against children spectrum? And in particular, you know, they're wanting to tease out how these concepts are covering men as victims. If you could address those questions, please.
Thank you, Lucy. I hope you can hear me. My network doesn't seem to be strong enough. So I'll address those two questions and try and address them together. So in terms of gender-based violence in its definition and the way that people, programmers and implementers and policymakers, in many ways, it does encompass children. But in as far as the violence that is perpetrated against children is influenced by notions of gender. And actually also not all forms of violence against children are gendered. And so it is important to have that distinction clearly laid out. And hence we see in the NSP that there's a lot of recognition about the violence that occurs in childhood and how that is linked to what happens in terms of exposure, victimization, and perpetration in adulthood. And in terms of youth and men being taken into account in these terms that we are using, yes, they are taken into account. Youth programs that are focusing on violence against children, for example, such as parenting programs, programs that are looking at behavior change to prevent gender-based violence, including stepping stones and creating futures. Those kinds of programs that we have actually do bring together both adolescent girls and adolescent boys, adult men and adult women. And so much as the terms may be strictly defined, but actually people who benefit are actually boys and girls and young men and young women. And I think even in some community programs that are implemented in communities, they also include adult men and adult women. And it's just that it is important to ensure that we have those distinctions because of the need to highlight the human rights that have been violated and persistently over years. And it is important to make sure that we acknowledge who is most victimized and who is most affected in our society. And the services, I also want to add, for men are also being made available by service providers. So there is no man who gets turned away from services because they don't fit into a particular profile of or terminology, whether it's GBV or violence against women. And I want to also add that the GBV term also allows for other marginalized groups to also be, included as beneficiaries, and also as people or groups that are acknowledged to be victimized, like the LGBTQIA+ community. Thank you so much.
Oops. Nwabisa, just before we move on, there have been also several questions with regards to adolescents and young people. And there's a question here that says, the adolescent and youth health policy does not adequately acknowledge how violence is very gendered and meet the need for primary prevention. And the question is, are there suggestions for how we could further analyse and address this gap?
Okay, so in terms of what can be done to analyze, working with the Violence Prevention Forum, which is a group of collaborators from government departments, research implementers, policymakers, and academics. We've learned that actually it is important when we want to analyze, policy, for instance, to actually write policy briefs or write, commentary that highlights the different challenges that we are seeing, but in a way that can be easily accessible and used by policymakers. And I would suggest again that it's important to also try and, bring to the attention of the Department of Basic Education, Department of Women and Social Development, those issues, and that can be done easily through the interim steering committee, and they're easily accessible and available to receive commentary. And we must remember that the process of policy change and law review is currently underway, so I'm sure that they would be happy to receive comments or any, indications that there are challenges in any space that we are working with, because that would help them to improve the work that they're doing. Thanks.
Excellent. Thank you for that response. And another area that's been highlighted in, I think, by all of the speakers and several of the guests who are posting in their questions and comment box is about resources. And Mayke, I'm going to turn to you now. There are, first of all, a question about DSD needs much more resources for preventative parental work. Where should they start? But I also want to draw attention to, before you begin to respond, both yourself and Nwabisa mentioned that, our context has changed dramatically this year with, we started the year with limited funding and concerns about a lack of resources for implementation. And of course, now with the COVID crisis, we are being, as both sectors, being required to, as Nwabisa, do more for less. So, and I think you in particular highlighted, the need for focusing resources on parental work. So that question, DSD needs more resources for preventive parental work. Where should they start?
Thank you so much, Lucy, for this question. It will be very important to clearly describe the program components for this nurturing care piece and the family strengthening component with the parenting programs that exist, compounded by home-based care visits and safe spaces after school, your drop-in centers, your safe parks, your safe spaces on the school compound. So this integrated package has been costed in an investment case with UNICEF support, but it will be important for DSD to also cost it and present to Treasury to make it a very clear bid to Treasury with targets and a costed framework. DSD has a large parenting program at scale like Sinovoyo. However, we are competing over resources, we all know that. So there is need to really create a social compact in society where the state is complemented resources from the corporate world to invest their core social investment in this after school space, the parenting programs and the home-based care visits, and to lend a hand to this young person as a mentor, to open up their networks, to give support for internships and bursaries, so that we really start looking at this child in a nurturing care framework with various actors who take a role and responsibility to making sure that young people are cared for, nurtured, protected, resilient, and can thrive into their own adulthood. Thank you.
And just before we move on, Mayke, there's a last question about the WHO's nurturing care framework, where it states that it's the basis for National Department of Health's Under 5 side-by-side efforts. Is there a way that we can integrate violence prevention strategies within such existing scaled primary health care strategies?
Yes, I was actually looking at it last night in preparation of today's webinar series. And when you look at the nurturing care framework that was developed for under 5s by the WHO, you also have an entire commitment on safety and security. So at the global levels, these commitments do exist, and I'm sure that we can work together, that also from a health perspective and in the health policy, we can integrate the need for safety and security. Thank you.
Thank you very much for those responses. And I think I'm going to just give each of the presenters, including Reverend Khumalo, the opportunity to say a few words in closing about their conclusions and hope for the way forward. A number of people have mentioned that, you know, we've seen fragmentation, competition for resources, and that there is a real need for collaboration. So if I can actually start with Kayan, can you give us a few words in closing?
Thank you. Just to reiterate my initial thoughts, I think the NSP is a good starting point, but we do need to ensure that the children's rights sector is more involved, and that we look at engaging better with youth and adolescents in particular, in framing some of the interventions in the relevant pillars, and see how we can better include some of the initial interventions that was in the 2018 draft plan of action. I think if we address some of these key gaps, we will be able to have a more comprehensive overall approach to addressing violence against women and children. Thanks.
Thank you. Mayke?
Thank you very much. The scourge is so high, and the challenges are multiple, and especially now that they have become exacerbated over the last 6 months with these intensified deprivations, but also higher levels of fear and anxiety amongst children, and higher levels of violence and abuse, plus a new complex issue of exploitation online and harassment and grooming, sexting online, etc. There is really a need for a call to action. As an emergency, like the whole total shutdown movement came together to fight for ending violence against women, we need that same level of concerted action, but make sure that there are sufficient coordinated frameworks at all levels amongst all actors, and that there are enough resources for violence prevention programs to really empower the caregiver in their community and with the schools to create a safe environment for children. Thank you.
Thank you, Mayke. Nwabisa?
Thank you, Lucy. As a parting shot, I would like to say that I think we need to recognize that as contributors and beneficiaries of the work on violence against children, violence against women, gender-based violence, that we are all affected and influenced by the significant structural inequalities of racism, gender inequality, discrimination, and poverty. And that as we do this work, we need to be conscious that we actually doing work that is meant to bring and alleviate and bring about peace and bring about healing to our communities. And that as we seek to work together, we should focus on that. We should focus on the fact that as much as we have had violence, you know, and not being prioritized in the country, we now have the opportunity to work together And that is what we should be focusing on. And that even though we are in a financially constrained environment right now, but if we make sure that the work that we're doing is structured such that we, much as we may be needing to do, and implement emergency programming and services, but we do need to have to still maintain a longer term view so that we can be able to see what impact this new NSP is having, so that we can be able to make sure that the work that's been done on the program of action is not lost, the program of action has been around much longer than the NSP. And that is where we have synergies between violence against women, violence against children. And we should be continuing to work very hard to build relationships and persevere with each other. It's a long-term process, but it is possible. And we've seen that it is possible through the Violence Prevention Forum. Thank you so much.
Thank you very much, Nwabisa. Reverend Khumalo.
Thank you, Lucy. I think we've had a lot of good things in the presentations by the colleagues. Policy is very important, of course. The challenge is in the implementation. We need to endeavor to ensure that all these good ideas that have been paraded here, we all remain vigilant that these are implemented for the good practice models that have been shared by UNICEF. How do we ensure that we scale those up so that indeed we enhance our response to the challenge of violence against children and violence against women? I think I would also make a call on this platform that we need to have more men coming into this space, because the burden of care and the burden of the challenge to ending gender-based violence cannot just be the role of women alone. We need to have more men playing a very important role in this space, contributing to all the efforts of ensuring that we live in a society where everyone is treated equally with dignity and with respect, and that as men we play a very important role in the lives of our children and invest emotionally in their development so that we can have a better future for all in our country. Thank you.
I'd like to say thank you very much to all our speakers and presenters and to everyone for joining us today. As you can see on the screen there, next week we will be having the final part of the webinar series where we'll be looking at exactly this question of how can we work together. And Naziswa Titi from the Children's Institute will be joined by Dr. Chandra Gould and Diketso Mufamedi from the Institute for Security Studies, who also happen to run the Violence Prevention Forum that Nwabisa has talked about today. And we will also have Lisa Vetten, seasoned campaigner for gender justice from the University of Johannesburg. Thank you again for joining us. All the links to the webinars and the recorded sessions will be available on the Children's Institute website. Thank you very much. Go well.